everyone, I'm Lavanya. Welcome to PeacePal.in. Today we are here to learn about substance abuse. Let's embark on a journey to learn about substance abuse and its effect on mental health on a deeper level. First, let's understand what is substance abuse. Substance abuse refers to the harmful or hazardous use of psychoactive substances, including alcohol or illicit drugs. This behavior can lead to addiction, which is a chronic, relapsing disorder characterized by compulsive drug-seeking, continued use despite harmful consequences and long-lasting changes in the brain. Substances commonly associated with abuse includes first, alcohol. Excessive and prolonged alcohol consumption can lead to physical and mental health problems, as well as social and legal issues. Second, illicit drugs. This category includes substances such as cocaine, heroin, methamphetamine, marijuana, and prescription drugs when used without a prescription or outside of prescribed guidelines. Third, prescription medications. The use of prescription medication, especially opioid painkillers, benzodiazepines, and stimulants, can lead to substance abuse and addiction. Factors contributing to substance abuse include genetic predisposition, environmental influences, psychological factors, and social pressures. Some common signs of substance abuse may include: first, loss of control, inability to limit use despite the desire to stop. Second, neglect of responsibilities, neglecting work, school, or family obligations due to substance use. Third, legal and financial problems, engaging in illegal activities to obtain substances or facing legal consequences because of substance use. Substance abuse and mental health are often interconnected and can have a complex relationship. Individuals experiencing mental health disorders may be more vulnerable to substance abuse, and substance abuse can increase or contribute to the development of mental health issues. This relationship is often referred to as a dual diagnosis or co-occurring disorders. Here are some key points that you can keep in mind to understand the relationship between substance abuse and mental health. First, self-medication. Some individuals with mental health disorders may turn to substances to cope with symptoms or alleviate emotional pain. For example, someone with anxiety may use alcohol to calm their nerves, or a person with depression might misuse stimulants to increase energy levels. Second, risk factors. Common risk factors contribute to both substance abuse and mental health disorders. These can include genetic predisposition, trauma, early exposure to substances, and environmental factors as a lack of support systems. Third, biological factors. Substance abuse can have a direct impact on brain chemistry, potentially leading to or worsening medical health or mental health disorders. Conversely, pre-existing mental health conditions may alter brain functions and increase susceptibility to substance abuse. Fourth, cycle of dependence. Substance abuse can contribute to a cycle of dependence. Continued use of substances can lead to addiction, which can then contribute to the persistence or worsening of mental health conditions. Fifth, increased vulnerability. Substance abuse can increase vulnerability to developing mental health disorders or trigger the onset of symptoms in individuals with a predisposition. Common co-occurring disorders include depression and substance abuse, anxiety disorders and substance abuse, and bipolar disorder and substance abuse. Dual diagnosis requires comprehensive and integrated treatment that addresses both substance use and mental health issues simultaneously. This may involve therapy, counseling, support groups, medication, and lifestyle changes. Coping with substance abuse can be hard and challenging, but with the right support and strategies, it is possible to overcome it. Here are some general steps that you can keep in mind to coping up with substance abuse. First, seek professional help. Consult with a healthcare professional, therapist, or addiction specialist to assess your situation and develop a personalized treatment plan. Consider outpatient or inpatient rehabilitation programs, counseling, or support groups. Second, build a support system. Surround yourself with supportive friends and family who understand your goals and are willing to provide encouragement. Attend support groups such as Alcoholics Anonymous (AA) or Narcotics Anonymous (NA) to connect with others facing similar challenges. Third, educate yourself. Learn about the nature of addiction, its effects on the body and mind, and the recovery process. Understanding the root cause of substance abuse can help you address underlying issues. Fourth, set realistic goals. Establish achievable short-term and long-term goals. Celebrate small victories to build confidence and motivation. Break down larger goals into manageable steps to avoid feeling overwhelmed. Fifth, develop coping skills. Identify and practice healthy coping mechanisms for stress, anxiety, and other triggers. This could include deep breathing, meditation, exercising, or engaging in other hobbies. Replace negative habits with positive ones to fill the void left by substance use. Sixth, create a structured routine. Establish a daily routine that includes healthy activities and provides a sense of purpose. Structure can help reduce the likelihood of falling back into old habits. Seventh, avoid triggers. Identify and avoid situations, places, or people that may trigger cravings or temptations to use substances. Make lifestyle changes to minimize exposure to triggers. Eighth, practice self-care. Prioritize yourself. Take care of yourself, such as getting enough sleep, maintaining a balanced diet, and exercising regularly. Focus on overall well-being to support your physical and mental well-being. Ninth, address underlying issues. Work with a therapist to explore and address any underlying emotional or psychological issues that contribute to substance abuse. Use therapy as a tool for personal growth and self-discovery. 10th, stay committed to recovery. Recognize that recovery is a lifelong process. Stay committed to your goals and be patient with yourself. Celebrate milestones and learn from setbacks, using them as opportunities for your growth. Treatment for substance abuse often involves a combination of behavioral therapy, counseling, support groups, and in some cases medication. It's crucial to address both the physical and psychological aspects of addiction for a comprehensive approach to recovery. Remember that seeking professional help is a crucial step in the recovery process. A healthcare provider or addiction specialist can guide you towards the most appropriate resources and interventions for your specific situation. It's important to tailor your approach to your unique needs and circumstances. Prevention efforts focus on education, awareness, and addressing risk factors at individuals, family, and community levels. Early intervention and treatment are essential to prevent the progression of substance abuse into more severe form of addiction. If you or someone you know is struggling with substance abuse, seeking help from a healthcare professional, counselors, or support groups is strongly recommended. You can check out our website peacepal.in for detailed information on various topics through our alternate videos and daily blog posts. You can also check out our store section for various courses, packages, appointments for therapy, and self-help books, because together we can make a difference.